we've come to the actual Frailty Scale. This helps us admit patients to hospice that don't have a specific diagnosis but are clearly declining towards their death. Here's the scale. I'm going to hold it up throughout the video. Perhaps you can take a picture of it and really have a chance to evaluate it for the use in your hospice, or if you're a family member or a friend, it help you determine whether it's time for a hospice evaluation. As you can see, points are awarded for each category and then a total is taken. These are the categories. I'm not going to read through all of them, but just comment on the ones that need more specific explanation. The first one has to do with gender. Most people are aware that men generally decline more rapidly than women in older age. So a person designated as a male is awarded 5 points. Men get 5, 0 women. Age is self-explanatory, as is weight loss. GFR is a measure of kidney function based on a blood test. Shortness of breath is defined as SOB, and it refers to someone who has air hunger or difficulty breathing when they're actually at rest in a chair or bed. Living away from one's home without family and attendance has its own challenges, and each facility, as we know, can vary its inability to provide consistent and thorough care. CHF stands for congestive heart failure. Has there been cognitive loss in the past 3 months? Whether there's actually a diagnosis such as dementia or Alzheimer's, has there been a significant change in the last 3 months? ADL, activities of daily living. This means dependence upon assistance, partial or complete, with 1 point for each need. This includes the ability to eat or feed oneself, getting dressed, bathing, transferring out of bed or chair, and then walking. Can they do it? What's the assistance needed? Perhaps they need a walker or a wheelchair. Toileting. Can they get to the toilet and handle all the functions needed to stay clean? What are the life goals at this point? One that is reviewed is their desire to utilize antibiotics, such as infection or UTI or pneumonia when it comes along. Remember, in hospice, we do treat infections if there's significant discomfort or pain, perhaps once, but it's not expected to be used as a curative goal. Have they had falls in the past month? 1 point for each, up to 5. Are there new instances of agitation, restlessness, or belligerent behavior? Now all of the scores are awarded and a total is taken, and you can see this score helps the admitting team decide whether Medicare would feel this patient meets hospice criteria. Again, it is often combined with other information about previous illnesses and diagnoses, so it doesn't mean that someone with a moderate score can't be admitted. It's taken into account with all the gathered data. This scale really helps our admitting professionals, and we're using it frequently, not only for our admissions, but for recertification evaluations, and those are the periodic evaluations that determine whether a patient can stay in hospice care. In the next video, I'll give you an example of how it worked in my world as a hospice nurse. Remember, please go to our website, hospicecareplan.com, and to our YouTube site to see many more instructive videos about end-of-life care. We so appreciate your watching. Have a good day, and remember our motto, care is treatment.